Hi everyone, this is Leanna Ferguson, and I am excited to be presenting to you my lesson plan on patient education, so I hope you enjoy. I have been a nurse for 8 years. I actually graduated December of 2009 from Florida State University. I live in Tampa, Florida. And I started my nursing career on medical surgical oncology unit, where I worked there for 3 years, and then I transitioned into the ICU and now currently work in the emergency department, where I never imagined myself being, and I actually love it. My practicum site was at Southeastern University, which is a Christian college, which was kind of nice. I'd never experienced that. I know that we all attend Concordia, but being in the classroom and seeing how you can incorporate Christian values publicly was a great experience. And I taught first semester nursing students in Foundations of Nursing Care, which was a wonderful experience because these students had that excitement, but also the nervousness, realizing that nursing school is a bit stressful, but also really excited about what's to come and really seeing them get it a little bit and hearing their stories of their clinical experience that they just started and seeing it kind of all put together. It was nice to see. And I worked with Professor Teresa Ousley. She has been an educator for over 20 years. Most of her experience is in the NICU, so I don't have any experience in that. Most of my experience is in adult. Therefore, we were able to kind of utilize each other in our teaching, because when it came to adults, she referred to me. When I came to pediatrics, I referred to her, and it was a great learning opportunity. My lesson plan topic was on patient education. As I've said, I chose this topic for a multitude of reasons. The first honest reason being that it was the latest one in the curriculum that caught my attention, where I felt that I had enough time to prepare and could actually implement what I learned rather than doing something earlier in the semester. And also because this is not a topic I'm really good at. It's something that we do every day, but I don't feel like I put in the effort that's needed. And I felt that if I could teach them, it would teach me as well. And I enjoyed a lot of the different techniques that I learned as far as evaluating, the learning of the patient, why my role is so important, what type of environments are important. I teach education every day in the emergency room, and we don't have closed doors. So being able to close the curtain and kind of make the atmosphere a little more conducive to their learning is something that I took away from this. Also, the role of the nurse in patient education and how important that is, and different teaching and communication methods that we can use as nurses and the students can learn to be able to really impart knowledge on their patients. Of course, patient education is one of the most important nursing interventions in healthcare. It affects the outcomes of patients' conditions. It helps them learn skills, gain knowledge, change attitudes. It encompasses such a variety of information that ultimately affects the patient's being. So I just felt that this would be an important topic and kind of fun all at the same time. Again, I had 21 first semester nursing students. There was 17 girls and 4 boys, which not very surprising because a lot of nursing schools have a lot of women, but the average age is about 21. So they're all juniors essentially in their 4-year process, but first semester nursing students. From just my conversation with the students, we have one dad. He actually was in the military and now is in nursing school. He has a wife. He just became a dad a couple months ago. And then there's another student where this is her second bachelor's degree. So she has a bachelor's in another area, and been trying to get into nursing school and couldn't. And now she's here. So everyone else, though, it's their first degree. They're all young, 20, 21. And a lot of them are from out of state, but some of them are from the area. They are a mix of Hispanic, Caucasian, and Asian, and I know this because they did cultural presentations, and a lot of them discussed what their backgrounds were. So it was interesting to kind of be able to put together where they're all from and what their backgrounds are from. And so it was nice to kind of see the different dynamics. This is a 6-credit course, one of the big ones, And actually this year they put together the didactic setting of foundations, but also added in the didactic lab work. So not only did they learn the didactic foundations, but they also learned the book knowledge of NG tube insertions, colostomies, medication administration. This was their first year that they actually did this. And my professor, Teresa, told me that they're probably going to change it around again next year because it was a little bit confusing for the students to be able to transition from learning in the classroom to actually implementing their knowledge in the lab. But it was a 6-credit course. That was for the didactic section. It is an in-class setting, so we were in a classroom. We met Tuesdays and Thursdays from 10 to 12:40, so it was a long class, 2.5 hours. They all sat in desks. There was 2 large windows, which was kind of nice for being able to have natural light, kind of keep you awake. There was the smart board, which I don't know if you all are familiar with that, but it's a board you can write on, but it's also a projector. We utilized it more for the projector setting for like PowerPoints, but you could also write on it. But there was also large whiteboards that we utilized to write on and teach, but it was a good classroom setting. The temperature was perfect pretty much every day. It wasn't too cold or hot. But we did utilize where we would, in group settings throughout the semester, they would go into groups and change their desks around. So that was nice, but it was your typical classroom setting. And it was a smaller class, which was nice as well. When first compiling learning objectives, I actually had 5 and narrowed it down to 4. The first of them being that I wanted the students to be able to identify the role of the nurse in patient education because they really need to understand what their role is. I determined this was a cognitive domain with Fink's foundational knowledge learning. Then I wanted them to be able to establish an environment that promotes learning, with this being the affective domain and the caring through Fink. I wanted them to also demonstrate appropriate communication principles and teaching methods when providing patient education through the psychomotor domain and Fink's human dimension. And lastly, I wanted them to be able to identify the purposes of patient education, so through the cognitive domain and the foundational knowledge of Fink. I like this picture that I've added in here because what the patient actually heard and what the nurse meant are usually completely different. So again, I wanted them to understand and be able to portray why patient education is so important and utilize different techniques for them to be able to comprehend and understand. So for the information gathering for the students throughout the semester up until this point, I had asked the students during different timings of class if they actually read the chapters before class, did they really watch the PowerPoint or read it? And most of them said no. So I knew that prior to my instruction, I needed to emphasize how important it was for them to read chapter 25, which was all about patient education. I also had posted a PowerPoint, which you can view here, on the power of patient education. And they already had a PowerPoint made by the publishers of the book that Teresa used, but I instead added in a voiceover, so it was kind of like teaching them without making it so pretty much boring for them to have to just read through the slides, which I know they would not comprehend. So I thought that if I actually put a voiceover and made it more interactive, that they would actually listen to it. And believe it or not, 3/4 of the class did. And during our in-class discussion, they were actually able to take away and explain examples that I use in the voiceover PowerPoint, which I was very proud. So I made sure again to tell them that it was very vital that they did the information gathering techniques because they were going to need it to be able to do the active learning throughout the class, which I think encouraged them all to kind of make sure that they did what they were supposed to do. The active learning strategy and the experience component was role play, which the students were placed into groups of 3. So there were 7 groups. I actually had the students count off 1, 2, 3 in the classroom so that they didn't pick their friends or pick the people that they usually are in groups with. I wanted for them to be able to work with their different peers. So what I did is I came up with 7 different role play scenarios, each of them having a different topic. They had things such as congestive heart failure, diabetes, asthma, chest pain, smoking, COPD, and I made envelopes. And in each envelope, there was a role description of the nurse, the patient, and the family member. And I cut them up so that there was separate papers in each envelope. And I went to each group and they each picked an envelope. They didn't know what disease process it was, so they just picked an envelope. And I told the students that I encouraged them to pull out the paper and be that person. So I didn't want them, I didn't want the person who's does all of the work to usually be the nurse. So I wanted them to have to pick their role out. Whether they did that or not, I don't know, but I did encourage it. And then they all worked together to plan their scenario. So it wasn't just that the role of the nurse planned the nurse's scenario and the patient and the family member. They all worked together to plan a scenario and a script, and then they had to present it to the class. So they were given 15 minutes to create a scenario, which needed to include but wasn't limited to the learning environment in which they would educate the patient and family, and the proper teaching and learning methods that they would use. I wanted them to be creative. I told them to use their own personality and to add in different components of patient education that they also thought were important through the in-class discussion that we did. They were given about 5 to 7 minutes to do their role play, but that usually went over for a multitude of reasons, was because they either had too much fun and there was a lot of laughing, or their role play was great and it just kind of kept, I didn't want to stop them at the minute mark when they were really had a lot of good components that they were adding and were able to really utilize their knowledge. So it usually was like 7 to 8 minutes that the role play went for, but I have to tell you that I almost wanted to cry because they were so creative, energetic, and excited about this. The students actually implemented what we discussed and learned, and they didn't just kind of do it halfway. They really put effort into it, and I could tell that they were implementing what they learned about teach-back methods and how to demonstrate and handouts that they could use. I did print out a bunch of education from my hospital of the different disease processes, and I put them on the table while they were planning their scenario, and they were able to come up and they had to choose which papers they wanted to use. They could use them to be handouts for the patient and talked about how they would give handouts for the patient to refer to, or they could use them to educate their patient. I'd explained to them in the beginning that this wasn't so much about assessing their knowledge on the disease process. It was about them being able to formulate a learning environment, to use the right teaching methods, the right evaluation methods for their patient, and making sure that they encompass what the patient needed in order to learn. So, which they all did. They did a wonderful job, and I was impressed. I was blown away, and I was honestly very proud, I have to say. It was a great experience, not only for them, but for me as well. The reflection component was utilized during the scenarios and then also after class. After each role play, I'd ask the group and the class what went well and what would you have added or done differently. Pretty much every time there was at least 1 or 2 students who had input, which really increased a lot of class discussion. A lot of great input as well, which I think was one of the reasons why the timing went a little longer, because the reflection and the discussion in class was more than I had actually expected, which was great. But each time, at least somebody had good input. One point that one of the students made, which I really enjoyed, was that he said, I noticed that during our scenarios, we talk a lot about why these things are important as far as the positive outcomes. But what about discussing with the patient what will happen if you don't do this? So what will happen if you continue smoking? What will happen if you don't take your medications? And he says not so much the scare tactic, but letting them know that there are side effects from not taking care of yourself, essentially, and educating the patient to let them know that there are negative sides that can come of your disease process, obviously, but not making it all about the positive, but also focusing on why they need to do what they need to do, which I loved. And it really allowed a lot of class discussion. And I noticed that in the reflection journals and in the in-class writing assignment, they also discussed that as well. So it was great conversation. Also, at the end of class, students answered 3 questions. They talked about their reflection of what is the role of the nurse and why it's important. What are 2 important concepts that they learned today, and why are these concepts important? But also, what value is this to your future as a registered nurse? Even though we talked about all the different learning objectives and was really able to implement those, I wanted them to be able to understand that what they're doing is of importance for their end result, which is to be a nurse, right? So I wanted them to be able to really focus and reflect on why this is important for their future. I like this quote by John Dewey. It says, "We do not learn from experience, we learn from reflecting on experience." While we all do learn from experience, it all comes from reflecting back and thinking back to what happened during that experience and how it went. So I hope that they can go back and reflect on the role plays that they did and remember the different components that they learned when they were able to actively implement them to then be able to utilize it in their nursing care. For the assessment of the student learning, I had planned an in-class writing assignment where they were given another scenario, so kind of like their role play, but a little more, but different. And then they had to answer these 3 questions. And these questions are similar to what they needed to do through role play, but the reason that I wanted them to write it out was because during their role play, they were able to use their book, they had handouts, they could kind of bounce ideas off of their group, where here they were actually utilizing their knowledge and having to write it down on paper without resources. So being able to really assess what they learned. And then last but not least, I developed a patient education quiz, which had 5 questions, which I really enjoyed. However, due to class time and the length of the role play and kind of the fun that they were having, we weren't able to do the patient education quiz, which was a little upsetting because I feel like it was a great assessment component, but at the same time, the discussion, the role play scenarios that they actually did, and the conversation was a lot of an assessment component for me as well, being able to see them actually utilize their knowledge. So I like this quote too: "The best teachers are those who show you where to look, but they don't tell you what to see." So I was giving them the idea of what they were supposed to do, giving them a role play, but allowing them to take what they were looking at and being able to develop something that they could see. So it was a great experience. Overall, again, I had kind of already touched on this. The students were very engaged. They were active. They really had a good time. They put their personalities into the role play, which the research that I read discussed that you don't want to give a lot of information for role play because then it constricts what they'll do with it, essentially. So I just gave them a couple sentences of the situation, and then they really did a great job at putting their own personality and also utilizing the knowledge that they knew. Again, a lot of creativity. They had a lot of fun. And I realized that it's a lot easier to implement active learning activities in the classroom when they actually have to gather the information beforehand. Throughout the semester, it was a lot of information giving through PowerPoints or concept maps or there was group work, but I found that it was easier to just review what they had already learned through the prior class requirements and then to actually implement their knowledge, which I found more fun and I think the students found more engaging from their feedback. A couple things I would have done differently is I would have prepared more discussion questions, kind of things that would have drawn out a little bit more detail. Like I said, they did a great job, but I think just for my assessment techniques as well and just even more detailed class discussion, I would have maybe compiled a few more class discussion questions. And then I probably would have added a reflection question related to the actual learning activity. I realized that I didn't really assess or get their feedback on paper so much as far as what they liked about this learning activity and how they learned best. They told me towards the end of the class, because I verbally asked, how did you like this? Was this fun? Was it something you'd want to do again? And pretty much all of them said yes. And I could tell because, like I said, they were very engaged and active. But it just would have been nice to have a written component for them to reflect on this type of learning. So another thing too is I of course would have loved to incorporate the quiz, but they will be utilizing this knowledge on their test that they actually take this week. So that was great. All in all, this was a wonderful experience. I really think that the students had a great job, had a great time. They were very active. They were excited. And I look forward to seeing what their test answers come up with the subject of patient education, and just be able to see that they actually utilized their knowledge and implemented it. It was nice to be able to see all of our hard work and my hard work put into a final, and seeing the outcomes. As again, I told you I was proud of the students, a little proud of myself too, but also just being able to see it all put together and kind of watch the light bulbs go off was just a great experience. And I hope you all had that kind of experience as well. I'm excited for what's next, and I hope you guys enjoyed this presentation. Thanks.